hormones change during the menopause. Okay, so thank you everybody for those who have joined. Welcome. Today we're going to talk about the part 1, exploring perimenopause and menopause, and we're going to talk about understanding the changes in women's body and how to help symptoms. We're going to focus mainly today about diet and exercise. Tomorrow on part 2, we're going to be talking about hormone replacement therapy and also how to manage sleep, how to manage stress. And then on day number 3, we're just also going to talk, if we don't have enough time tomorrow, we might finish a portion on Wednesday. And then we're also going to talk about how to help to support menopause with aromatherapy and some essential oils too. And hey, so, well, the rest of the people can join. But I want to respect everybody's time, especially for the people who join early. So, all right. Without any more waiting, let's start. Let's submit one more person. All right. Okay. So for those who doesn't know me, my name is Lisani Estopinian. I'm a medical doctor specialized in internal medicine. And I'm currently, I live in the United States and work in the state of Utah. And I'm currently working on getting my certification also in functional medicine. Okay. Has this ever happened to you? Well, you're not alone, girls. Actually, I'm 43, and I was probably since my late few months before I turned 43 is when I start experiencing some symptoms of hot flashes. And they are not fun. Middle of the night, suddenly you wake up, your pajamas are all sweat, and then you threw your blankets and your sheets and everything towards your husband. Is like, oh my God. Then you have to wake up and turn off the air conditioner and sometimes even change your pajamas. They're really, really so wet. And yes, at the age of 43, I have to say I started already experiencing symptoms of, I'm with you girls. The reason why I decided to actually talk about this topic is because in my practice, I start noticing a significant amount of women who come to me and they have either been seeing other providers or they just has been following with me. And I realized that they were really, really struggling with all the symptoms in perimenopause and menopause. And I have to be honest, it wasn't until I started experiencing symptoms firsthand that I really say, I have to do something. I have to support other women, my patients, women in my community, to learn more and understand what they can do. And unfortunately, in the Western medicine, we tend to put things in terms of body parts and send, for example, if you're having a heart problem, who do you go to see? A cardiology. If you're having an eye problem, you go to see an ophthalmology. But what happens if I'm having menopause symptoms? Who do I go to? Do I go to my family doctor? Do I go to see my internal medicine doctor? Do I have to go and see an endocrinology? Do I have to go and see my OBGYN specialist? And why the OBGYN? Because, well, it's a problem on the ovaries, right? So let's just go and see the OBGYN doctor. But the OBGYN doctor doesn't really understand or comprehend completely the impact that menopause can cause in women's brain. And then we have neurologists or neurosurgeons, and that's also not the territory, or psychiatrists. So then we kind of end up being kind of helpless. And unfortunately, there is not enough education about menopause in medical schools. Even residents who are training in OBGYN, only 1 out of 5 residents really get training in menopause. And it's actually the minimal training. So they still doesn't feel comfortable when it's time about talking about or treating patients with menopause. All right, let's keep on going. So the menopause. As a symphony of bodily changes that rivals even the most dramatic experience tragedies. Picture this, your body at once bustling marketplace of hormones now is a deserted wasteland with estrogen and progesterone biting like a star-crossed lovers. The curtains raise and the hot flashes, a performance that leave you feeling like a human torch in a snowstorm. And let's not forget about mood swings, darling. One moment you are the picture of serenity, and the next you are a tempest of emotions, tossing and turning like a ship lost at sea. But fear not, for this just is the overture. Next up, we have the infamous night sweats, where sleep eludes you and your sheets become a battleground of damn despair. And let us not overlook the weight gain, a cruel twist of fate that sees your once spell figure transform into a silhouette that even Picasso will find perplexing. But fear not, for these too shall pass. Like a phoenix rising from the ashes, you will emerge from this hormonal maelstrom, stronger, wiser, and perhaps with a newfound appreciation for the simple joys of a good night's sleep. So embrace the menopause, my dear, for it is but a chapter in the grand novel of your life, and you, my darling, are the fearless protagonist. Hey, ladies. So let's start. What is menopause and perimenopause? So let's start with the definition. So perimenopause is the phase that starts towards the end of the menopausal transition and continues into the first year after the final menstrual period. Typically, you start perimenopause anywhere between late 30s and you reach, typically, or most of women reach menopause around the age of 51 to 53. So you have experienced menopause or perimenopause and begun menopause once that you have had 12 consecutive months without period. Menopause is the ending of the menstrual cycle. Clinically speaking, the menopause transition is complete after 12 consecutive months since the final menstrual period. And there are different ways to achieve menopause. It can be spontaneous or it could be also induced. However, one way to another, all women go through menopause. Postmenopause, the stage starting 12 months after the final menstrual period. Early or premature menopause, it's when it happens before the age of 40 for premature, and it's early when it happens before age 45. And it can cause or be caused by different reasons, but genetic factors, PCOS, polycystic ovarian syndrome, autoimmune diseases, infections, surgeries, or medical treatments. Induced menopause is when menstruation ends due to surgical removal of the ovaries, which is called oophorectomy, or the lapsing of ovarian function due to medical procedures, such as chemotherapy or radiation. Surgical menopause is the menopause that is provoked by surgical procedures. It can occur at any age as a result of a bilateral oophorectomy, which when you have both ovaries removed. It could be also due to a bilateral salpingo oophorectomy, which is then remove both ovaries and both fallopian tubes, or when you have a total hysterectomy, where the doctors remove surgically your uterus, your cervix, both of your ovaries, and your fallopian tubes. Notes that a partial hysterectomy, when there is only the removal of the uterus, but not the ovaries, does not lead to menopause. Also, if you do have ovarian cysts removed, doesn't lead to menopause or early menopause, and endometrial ablation also doesn't lead to early menopause or menopause. However, it has been known that some of these procedures could potentially affect the blood flow of the ovaries, which it can prompting menopause symptoms to start earlier in life. Medical menopause is the menopause that is provoked by medical treatments that cause temporary or permanent damage of the ovaries. And it can cause as a result of many treatments like radiation, chemotherapy, estrogens, blockers, for example, tamoxifen, which is a medication that blocks your estrogen-specific actions. And a lot of women who take this medication as consequence of breast cancer. Aromatase inhibitors, these include medications that, for example, anastrozole is another medication that is used on patients after they has been or get breast cancer and they have gone through surgery, possible chemotherapy and the radiation, and then they have to be on this medication for a certain amount of time. These medications also stop estrogen production throughout the body, which it can lead to early menopause. And then we have other medications like growth hormone agonist medications that they keeps the ovary from making estrogen and progesterone, and they can stop ovulation as well. Symptoms of menopause and perimenopause. Well, there's so many. This is just a very few list, but it's just kind of like the most common ones. But hot flashes, night sweats, mood changes. Again, one moment you are so happy and the next one you're very, very moody. You could start having vaginal dryness, which it can lead to discomfort during intercourse as well. You can have difficulty sleeping, either because of the night sweat or just insomnia. You are more irritated and annoying, and you have these, again, mood changes that you cannot even stand yourself. You could also start experiencing urinary problems. So bladder problems is also a symptom of perimenopause or menopause, where you can have more propensity to have urinary tract infections. You could also have symptoms like leakage, going to the bathroom more often, waking up at night also more often. You could also experience brain fog. That's real, ladies, and it's also been seen in menopause and perimenopause. It's just that you're feeling that you're not thinking as clear, you are not as able to multitask as you used before. I'm having issues concentrating, which I never had problems before. And again, it's because as estrogen specifically start declining, it also start leading to changes in women's brain. And this has actually been studied on images, studies that has been conducted with neuroscience and neurosurgeons. It can also increase the risk of having anxiety and depression and difficulty to lose weight or weight gain, especially at the level of the abdomen. Again, this is just the most common ones, but there are other symptoms also out there that women can experience. It is important as a doctor to distinguish between having anxiety and depression just because of perimenopause or menopause, or having an underlying, history of major depression disorder or anxiety disorder. Okay. It is important that we understand how our hormone works. So understand our body. So the first thing is that we have to understand that our hormones are affected by two groups of hormones. We do have in one side the team that is composed by the adrenal team, which is composed by the hypothalamus, pituitary gland, and then the adrenal glands. And this controls the production of cortisol. And believe it or not, cortisol does affect our sex hormones in a negative way. Then the other team is the team that is composed by the hypothalamus, the pituitary glands, and then the ovaries. And this is the one that can take care of producing and control the production of estrogen, progesterone, and testosterone. So here we explain, if we have this image and we look on the right, we do have the hypothalamus, which again is a portion that is localized inside our brain. And the hypothalamus take care of release a hormone that is called the CRH, which impact or have an effect in the pituitary gland, which you also have, right here. And then the pituitary gland, who take care of secreting a lot of hormones, but specifically for the production of cortisol, is going to release the ACTH that then goes into the bloodstream and it reaches the adrenal glands, which are these two glands that are on top of the kidneys. And they're the ones who take care of producing cortisol amongst other hormones as well. And the cortisol is the stress hormone. Then the other axis, as we can see again, start also on the hypothalamus. This take care of releasing LHRH hormone that stimulates the pituitary gland, and then the pituitary gland take care of releasing into the bloodstream two hormones. One is the FSH with a follicular stimulant hormone, and then the LH with the lutein hormone. And then once that they reach the ovaries to the bloodstream, they take care of, again, controlling the production of estrogen and progesterone. Okay. Now, this is a female's menstrual cycle, and this is kind of like, it can change, I mean, based on, there are some women who has shorter periods below 28, some has larger menstrual cycles that could be 35 days. Again, this is just average of 28 days, and we just gonna explain here how typically our hormones go through just a normal cycle in a female who is still ovulating, and again, it has not reached menopause yet. So as you can see on the left side, day number 1 is the first day of bleeding, and during this cycle, the hormones, with the exception of progesterone, they start relatively to go up. Specifically the blue one, which is the estrogen, it has and play a significant and major role during the first 14 days or the first half of the cycle, which is called the follicular phase. And the estrogen is the one who take care of, prepare us for, again, reaching ovulation. While the progesterone plays a major role on the second part of the cycle, which is assuming the last 2 weeks right before we bleed, and it's called the luteal phase. And here, this really doesn't show how high is actually reached progesterone compared with estrogen, because estrogen is actually measured in nanograms, which is a lower dose, versus progesterone is actually expressed in milligrams. So, I mean, the amount of progesterone we release really during the luteal phase is significantly high. And then we have in the middle, right, the ovulation. And then if we do have intercourse during this time of ovulation and we get pregnant, then the one that is going to take care of supporting that pregnancy is specifically the progesterone, that is the initial portion. Okay. Now, if you see at the first graph on the right side, this is kind of similar to what I already explained. You see that estrogen is in orange, and then progesterone is in purple. And then we do have the LH and the FSH, which are the hormones that, again, are coming and released from the pituitary gland in the brain. But if we look at the second graph, this is actually how our hormones are on those women who does take birth control pill. And because you take the pill every day, you have these, cycle steady amount of hormones, including progesterone and estrogen. And then typically the birth control pills are, you take them for like about 3 weeks or 21 days. And then you have these 7 days sugar pill or placebo pills that you take for an additional 7 days. And then that's when you tend to bleed. It's not really menstruation, is not a real one. This is just a consequences of the withdrawal from the hormones that you stop taking. And then at the bottom, we see how the menstrual cycle looks for a woman who is already starting into premenopause and then menopause. So as you can see on the bottom graphic number C, our hormones are non-steady. They are not, like steady like on the top. This is just, we have these up and down in our hormones, both estrogen and progesterone. So that's why during the perimenopause, you might have days where you're going to feel really, really good and you're not having any hot flashes or any symptoms. And then suddenly you feel like crap, okay? And you start like having very moody and you don't feel well. Again, it's when your hormones start getting to the bottom and then they can go up. It's very tricky checking hormone levels on a woman that is not taking any hormone replacement therapy or taking any birth control pill during the perimenopause, because again, it depends also how your hormones are during that time where you actually go ahead and check the hormones. And by the way, in order to make the diagnosis of perimenopause or menopause, we really do not need to have a proof of, oh yeah, your estrogen and progesterone are low. It is helpful if we want to be putting the patient on treatments. So it can help us to make sure that we're not giving too much. but it's not necessarily to really make the diagnosis. I mean, this is based on symptoms, again, the proper age on women's, and again, mostly symptoms. Okay. Now, I want to spend some time here just to explain about statistics about women's, okay, in the United States as caregivers. Because I'm sure that a lot of us, some of the ladies that are here probably are going through this. Approximately 66% of the caregivers in the United States are females. And the average age of these women is around 49 years old. And they work outside the home, and they provide about 20 hours per week of unpaid care for a mother or a parent, or maybe even a mother-in-law or a father-in-law. Although men also provide assistance, female caregivers may spend as much as 50% more time providing care than male caregivers. And the estimate indicates that approximately 20% of all the female workers in the United States are family caregivers. Nearly 75% of unpaid caregivers in the US are women. On average, those female caregivers spend almost an equivalent number of hours per week providing care for people traditionally that they would spend doing a full-time job. And 2 out of every 3 caregivers in the United States are women, providing daily and regular support to children, adults, and people with chronic illness or disability. And women who are caregivers has greater risk for poor physical and mental health, including depression and anxiety. Why am I talking about and throwing all these numbers? Because I just told you that our sex hormones are affected by, the axis where you go into the hypothalamus, pituitary gland, and then the ovaries, but also through the cortisol and the adrenal glands. And how chronic stress affects our sex hormones? Well, not in a good way. It's actually in a very negative way, because when you have the tiger in front of you, which is, again, the stress, and it could be literally a situation of stress, but it also could be just the stress of daily life, like daily, like taking care of the kids and the cooking and going to work, or take care of the house, or again, take care of my mom or my dad. And, a lot of women's also helps husbands in a lot of things from their work, or, take care of managing the checkbooks, I mean, everything. And all those things create stress. And typically we tend to give time to everybody, but not time to ourselves. So then when you're being chased by the tiger, that's not the time to start thinking about procreation and ovulation and let's have a baby. No, your hormones shut down and then cortisol rise. So it's what we call fight or flight. And this could be even mental stress. And our body is designed to actually get and manage acute stress, like an illness, a situation of, again, just stress. But when the stress becomes chronic and a part of our daily life, when it actually comes like there is no stress, where never has a situation when there is no stress in our life, that can significantly cause a negative impact, again, in our sex hormones. It can lead to even symptoms of early perimenopause and menopause. And let me just explain you how it does that. So we have the hypothalamus, okay? And if you look on the left side, you do have that the hypothalamus releases the CRH, which is one of the stress hormones. That goes into the pituitary gland, which releases ACTH hormone, and then that goes into the adrenal glands, releasing cortisol. Once you have high cortisol, have a negative impact on all the hormones that has to do with the sex hormone. So it affects the pituitary gland, giving a negative feedback, and then doesn't release the hormone that stimulates the pituitary, the releasing of the luteal hormone and the follicular stimulator hormone, which at the end also goes into the ovaries, and then decrease the levels of estrogen and other hormones too. So you see how, again, chronic stress can definitely have a negative impact in our health, among other things. And this is what we call the cortisol steal. So our hormones requires cholesterol for production, okay? Then from cholesterol, we're gonna produce pregnenolone. And pregnenolone can follow in different pathways. Typically, it can go into the right, which is the 17-hydroxypregnenolone. And from there, we will produce DHEA, which is one of our other sex hormones. And from there, we're going to produce androstenedione, which it can go into testosterone. And then we can produce from androstenedione itself estrogen, but also we can produce estrogen from testosterone. Now, pregnenolone can also follow a different pathway, which is also the production of progesterone. But when we are under stress all the time, ladies, the balance is going to go towards the left side. So we're not going to pay attention, or it's not as important, the production of testosterone and again, estrogen or even progesterone. All these hormones are going to sacrifice to shift to the production of cortisol, which is the hormone that we need during the situations of chronic stress. And at the beginning, the cortisol, if we check it, is high because again, we're in stress. But eventually, even the cortisol, decline, and we end up developing what we call pituitary, hypothalamus pituitary adrenal axis dysfunction, which is not the same as having what we call Addison's disease, when your adrenal glands are not producing any of the hormones, or Cushing syndrome. These are the extreme situations. We're talking about what is in the middle, because again, it's a consequence of chronic stress in our life. The hormone cortisol, again, is the Russian woman's hormone. It creates a response to stress. It also takes care of regulating metabolism. It suppresses inflammation. It also takes care of regulating blood pressure. So when we are exposed to chronic and high levels of cortisol, we can start experiencing symptoms like hypertension. It also has an influence controlling blood sugar. So when cortisol goes up, insulin goes up. And then when we have chronic elevated insulin too, that leads to insulin resistance, and then blood sugar goes up, which make it even worse. And then we start storing all these sugar as fat. And it also has to do to regulate the sleep and awake cycle. Estrogen is the hormone that, again, helps us to stimulate the egg follicle growth. It also influences vaginal lubrication and maintains the vaginal wall thickness, maintain the mucous membranes in the uterus, develop the breast tissue when we're younger. It also has an impact regulating cholesterol levels, regulation of menstrual cycles, and also regulation on the developing and the functioning of the uterus. The progesterone, when it's low, this is the hormone that basically helps us to regulate our menstruation, but it also supports pregnancy on women who are pregnant, at least at the beginning of the pregnancy. And when we're low in progesterone, we also can have issues with irregular menstrual periods, difficulty conceiving or fertility problems, mood changes, anxiety and depression, trouble sleeping, and hot flashes. But estrogen can also cause that. Don't forget about testosterone. We think as testosterone as only like a male hormone, but that's not true. We also produce testosterone, and it's important in different aspects, but mostly importantly on sex drive or libido, motivation, and then building muscle. So when we exercise, our testosterone helps us to, again, be able to produce the muscles and be strong. Just to show you here quickly, in yellow, you will see how in a regular woman who has a normal menstrual cycle, how testosterone goes up at its peak during the ovulation. And there is a reason for that, right? When we are ovulating, it's time to make a baby, even if you want it or not, but your body is designed for that. So testosterone goes up to make your skin beautiful, and it makes you feel great, make you feel strong, and increase your libido. So then you are in the target for that perfect partner that it will put the seed, and then you can get pregnant. Again, this is the final destination of having the menstrual cycle, right? It's conception and having a baby. Again, we want it or not. All right, so how can we support for menopause symptoms or perimenopause symptoms with lifestyle and integrative health. Well, today we're going to talk about the first two, which is exercise, diet, and nutrition. Tomorrow we're going to be talking about the other aspects, and I'm going to explain information about hormone replacement therapy and non-hormonal treatments, and again, talk about how we can improve stress reduction, sleep hygiene, and how toxins and estrogen disruptors can affect our hormones too. So let's start with the exercise. So exercise has a very powerful influence in menopause. Think of your brain as a muscle, and you have to train it, right? You have to go to the gym, and you have to, again, exercise your muscle and your brain. The benefits of exercise in menopause has been proven on multiple studies and clinical trials. It does have and support healthy weight and metabolism, reduce the risk of heart disease, and decrease the risk of diabetes as well. It also can help to reduce hot flashes when we exercise regularly, okay? It helps you to sleep better. It also helps you to have better mood and sense of well-being. It also can help with memory and cognition and decrease the risk of dementia overall. It also helps you to keep strain on your bones, and you have fewer or less injuries, and it also improves longevity. So how often do we need to exercise during, again, menopause and perimenopause? Well, if you are doing this or you are exercising before menopause, the recommendation is, and this has been studied, again, this is, again, the results and the recommendations of clinical trial, and these are the recommendations by the American Society of Menopause. So before menopause, the recommendation is that you exercise about 4 to 5 days a week for 45 minutes to 60 minutes session per week. I know, that's a lot. With a lot of us, it sounds like impossible because our work schedule and our life doesn't really give us time for this. But this is what it has shown to prove having benefits on the symptoms of menopause and perimenopause. So when you actually do this frequency of exercise, this has improved and support your hormones health, and also has improved fertility in women. Okay. Remember that the longer that you are further, then you will get later to menopause too. Okay. Now, when you are already reached menopause, let's say in your early 50s through age 65, the recommendation is that you should be exercising between 3 to 5 days a week, about 30 to 60 minutes. And the duration and intensity of the workouts can be varies depending on your age. As you start getting more close to 65, maybe, you know, the intensity can be less, or the duration. And after age 70, the recommendation is that you do daily sessions, at least 15 minutes each are good. But if you can do more, then you can. And this helps significantly. Think about this. What happens to our elderly population in any part of the world, but here in the United States, our elderly end up going to the hospitals a lot because they fail, because they have issues with balance. And we don't want to reach age 70 and, again, being falling. And then if we never exercise and we do have osteoporosis, breaking our bones. Now, how hard should we exercise, and what type of exercise should we do, right? Now we know that, again, for me, I'm 43, I should be exercising 4 to 5 days a week for like about 45 to 60 minutes. Okay, but how hard? Again, studies have shown that the best workout for women in perimenopause and menopause is moderate intensity. Low intensity really doesn't work, and high intensity has also shown that it's not as beneficial for the symptoms as working on moderate intensity. And what do I mean by that? Well, you have to be exercising in a pace where your heart rate goes up, okay? And where you actually start feeling that you actually start perspiring and sweating, okay? Now, what type of exercise should we do? Aerobic exercise we should be doing, and that includes things like walking fast pace, jogging, running, hiking, going to a class at the gym, which it could be like, I don't know, a Zumba class, a kickbox class that you could do for, again, an hour at the gym. You also need to work on strengthening exercise. And this means lifting weight. Yes, we need to lift weight. Why? Because it does have a positive impact, increasing muscle mass, but also it's the type of exercise that also helps to support bone health and improve or decrease chances of menopause, osteoporosis. And also we need to work on flexibility and balance exercise, incorporating these. So for example, yoga. If you also do jitsu, karate, if you work on things like Pilates, either if it's reform Pilates or standard Pilates, it helps. So we should combine all these type of physical activity in a moderate intensity, again, multiple times during the week. And again, depending on the age, your classes could be anywhere between only 30 minutes, maybe 50 minutes, to maybe a whole hour of workout, okay? An ideal combination will be maybe going for walking or jogging maybe 3 or 4 days a week, or maybe at least 30 to 45 minutes, and then you go to maybe doing a class of a high intensity, maybe it could be a dancing class or a kickbox class, and then at the end of the week, maybe you just go to a yoga class, meditation, and again, or it could be Pilates class. That way you combine them. Okay, let's talk a little bit about step 2, which is diet and nutrition. And we need to think about food as medicine. So at this age, we need to up the game, ladies, with the food, and good nutrition is important, not just for general health, but also to support our hormones, okay? So the Green and Mediterranean diet is the diet that has been shown to support better our hormones. I'm talking about Mediterranean diet that I don't know if everybody has heard about it, but it is a diet that it has a lot of benefits. Number one, is low in calories, is high in fiber, is high in healthy fats, and it also is high in complex carbohydrates and less on simple carbohydrates. So let's break this down a little bit more. So during the Green Mediterranean diet actually encourages you to eat more plant-based, and eat with a rainbow. Basically, you should try to have in your plate at least 5 or 6 colors between fruits and vegetables. And I actually have been following these for at least the last year and a half. And I have to tell you that if I don't have at least 6 colors on my plate, I'm not happy. I always also try new vegetables I have never tried, to get the benefits of all the possible nutrients that you can. So plant foods are high in vitamins, minerals, and also phytonutrients, which it helps to support and give you so many benefits on your health. It helps to fight diseases, it decreases inflammation in your body, it promotes resilience throughout the entire body, has a positive effect on blood sugar. Make a mistake, put only blood with only one O. Insulin and digestion, it balances your estrogen levels too, and facilitate the action of the sex hormone binding globulin, which are the hormones in the blood that regulates and bind with estrogen and testosterone. Okay. Now, let's focus also on essential fats, okay? And it is important that we focus on eating omega-3s. Why? Because unfortunately, the ALA, which is the alpha linoleic acid, which is found in plant foods, or the EPA, or the DHA, are found in fish and seafoods, but we do not, our body cannot produce these type of fats. So we need to get them from food. It's the only way that we can really get these, okay? Sources or potential sources for good fats: brown, flax seeds, hemp seeds, walnuts, almonds, olive oil, avocados, soybeans, broccoli, sweet peas, and many leafy greens. And like I mentioned before, eating fish, seafoods, seaweed, and algae. And actually, early today, one of my snacks was actually seaweed. They sell it. The one that I buy has actually olive oil, and it looks like a paper. My friend Monica, who is here today, she make fun of me because, yeah, you're eating your paper. I'm like, yeah, but it's also rich in iodine, which is support my thyroid gland. Okay. The other important thing is that we need to focus on it for our cycles, right? I just told you that the first 2 weeks after you start bleeding on your cycle, your main hormone is estrogen. So you need to come up with a game to actually support that estrogen during those first 2 weeks of your cycle, if you're still having your cycle, and then progesterone on the last 2 weeks, you're still having your cycles. If you're not, you eat them all because you want to try to support the very little amount of estrogen and progesterone that you still have. So you need to eat this kind of foods. So for example, estrogen building foods include flax seeds, sesame seeds, soybeans or edamames, garlic, apricots, dates, prunes, peaches, berries, and cruciferous are extremely important for our estrogen. So eating broccoli, cauliflower, Brussels sprouts, broccoli sprouts also. For progesterone, however, we eat more like things like citrus fruits or tropical fruits, quinoa, squash, potatoes on every color that you want, and beans. They're really good to support, again, progesterone. Now, it is also important that we support our hormones with lean proteins. I'm not saying that we're not going to eat any meats, okay, from animals. I do eat, animal meats, but this type of specific proteins really helps to support our hormones, like I said. So things like seitan, which is really rich in protein, tofu, tempeh, and edamame. It has also a great amount of protein. At age 42, I started actually eating tofu. I try to cook tofu at least once a week, in addition to my fish and my chickens and all my other, proteins. Lentils also has a high amount of proteins, like beans, quinoa, green peas, spirulina, hemp seeds, and oats, but in a less proportion in terms of protein. Okay. And it is also important that we support our foods that are rich in iron, okay? Foods that are rich in vitamin B12, especially for those patients who are vegan or they only eat vegetables. It is important that since the only sources or the main sources of vitamin B12 are coming from animals, then you need to take a supplementation, again, to help to support and not become vitamin B12 deficiency. It's important that we eat foods rich in calcium, that is not just in berries or cheese or yogurt. We also can get calcium from other foods. For example, tofu has a really, really high amount of calcium. And also green vegetables has or can support and provide nutrients in terms of calcium. Melatonin to help you sleep and support sleep. So for example, if you're struggling to sleep, melatonin, you can get natural melatonin from eating pistachios. Just maybe 30 minutes before you're going to bed, you can throw yourself like a bunch of pistachios. And again, that actually can naturally increase melatonin. And tomorrow we're going to talk about things that it can help to improve sleep. Now, it is also important that we support our gut bacteria, which is called the microbiome, with good foods that are rich in polyphenols, foods like clove, olive, dark chocolates, berries, raw nuts, foods that are rich in prebiotics, which is basically fiber that feeds the bacteria. So foods like chia seeds, hemp seeds, and flax seeds, and then probiotics foods to actually put new bacteria inside our microbiome and gut. Things like sauerkraut, kimchi, apple cider vinegar, kefir, miso, kombucha, all those things we need to also combine and eat regularly so that we can, again, support our microbiome, because the microbiome actually can affect, ladies, our hormones in multiple ways. So it's called estrobolome. Estrobolome is the group of bacteria or microorganisms specialized in help you in your menopause journey. It's made of a group of over 60 bacteria that we have in the gut that help us to regulate our hormones during this transition period. So microbiomes in the strobolome produce beta-glucuronase, which is an enzyme that ensures that the little estrogen that we have produced in your menopause years gets activated in the cells. So it is really, really important that we, again, support our good bacteria so that it keeps our estrogen working at its best. Dysbiosis, which is that disbalance in the microbiome or in the gut, where we have too many of the bad guys and not too many of the good guys, can lead to imbalance in our estrogen. And common signs that you could be having balance issues in your strobolome include, again, bloating or digestive upset stomach, acne, low libido, again, heavier lights or irregular periods, tender or swelling breasts or fibrocystic breasts, headaches, weight gain, hot flashes, mood swings, again, PCOS, and it can also predispose to certain cancers. There is tests out there that are available for checking your microbiome. Again, there are multiple tests out there. Biomeg effects is one of them. I love the Nova Diagnostic. But lactobacillus specifically, Lactobacillus reuteri and the Lactobacillus rhamnosus are estrogen balanced bacteria. So it is important that these guys, we have them inside. So again, it can optimize how are we really utilizing estrogen in our body. Adding foods that are rich with phytoestrogen foods in our diet can help to support these bacteria too, as well as eating foods that are rich in probiotics. And just for today, just to finalize and close, I want to just briefly do a little exercise about self-love. To fall in love with yourself is the first secret of happiness. This is Robert Morelli. We tend to take care of everybody. We tend to be the mom, the best daughter, the best wife, the best neighbor, the best member of the church, and we forget about ourselves sometimes. We are selfish with ourselves a lot of the times, and we put ourselves last. We take care of the kids, take care of the house, take care of our business, or go to work, or take care of the house, and take care of, again, caregivers. And we really do not support ourselves and love ourselves enough. And that's not good, because I just explained you how having stress, chronic stress in our life impact in a negative way our sex hormones. So it is impossible to not have stress in our life, I think, unless that you go and move in the middle of nowhere where you have absolutely access to no technology and no other people's, or and that's not really realistic. But in this crazy world, we need to find time to take care of ourselves. Imagine for a moment, if you close your eyes and think about your best friend in your entire life, that sister that you chose a few years ago, or maybe during childhood, that you love, and that you always are there for that person when she calls and she says that she's not feeling well, she's having issues in her marriage, or one of her children is not doing well. Well, you are always there for that friend. You grab the phone, you show up, and you are there for her, and you support her. Well, why do we feel bad when we are gonna then support ourselves? And we shouldn't have those feelings of, oh my God, no, how am I going to spend this time for me? No, do it. Put in your calendar every week that you're going to spend time taking care of yourself. Either if during that time you just go to the park, read a book, go and meet your friends, go and play a sport, go and play tennis, pickleball, go and run, go hiking on your own. Just spend that time for you. And again, make it a priority, because you cannot give what you don't have, and nobody can drink from an empty cup. So if we don't spend time taking care of ourselves, ladies, well, then again, your hormones and you are going to pay the price. So I just want to bring this final thought today, and I hope that this was helpful. And tomorrow we're going to continue at the same time. And again, I'm going to focus tomorrow more about the hormone replacement therapy and botanical supplements in a natural ways, and talking about sleep and stress management too. I hope that you guys can join. We are going to stop here so then we can answer any questions.